I've seen the trauma that can happen from having an unexpected hospitalisation. The patient has a heart attack and suddenly they've discovered that they need to have a triple bypass. The thought of having that surgery, it's very invasive, can be very stressful on the body, the family, the person themselves. Typically following a heart attack, a patient will start rehab anywhere between 2 and 4 weeks following surgery. The cardiac rehab program is twice weekly sessions for 6 weeks. We take every level of fitness, so if you were a gym goer before you came in, we will take you. If you've never exercised before, I just had an 85-year-old lady step on a treadmill for 2 minutes for the first time in her life.
Well, in January this year, I was diagnosed with angina. Came into hospital to have a stent put in, and after that, I thought this might be the beginning of the end. Anyway, I was contacted by Erin to come along to the cardiac rehab course, and I really wanted to know a bit more about nutrition and the after effects of the medications I was taking. And I'm so glad that I came. I didn't realise how unfit I was until I started trying to do the exercises here. And I left much fitter, and it's really the start of another chapter for me. And I recommend it to anyone who's had a procedure like I have to come along. You will benefit from it.
When the patients first come in, they're very scared, I can tell. It's that fear of not knowing what they're going to be doing in the class and how far they can actually push themselves. By the end of the 6 weeks though, that scared, frail sort of patient that comes in with their shoulders down, we do a walking test at the end of the program where their shoulders are back, their confidence is up, they've got big smiles on their faces, and you can tell that they've got that real sense of, I've done this, I've actually smashed this program, and here I am.
The program was good. My wife tried to put me in cotton wool, you know, don't do this, don't do that, don't do anything really, and you know, here it was showing that you could push quite hard. The doctor was helpful as well. All the people that came in were really good at how to explain things. I'm doing a lot more exercise now, you know, at home, and I've got some weights and a walking machine, and which we had before, but it just was sort of gathering dust in the corner. So it's out now. It's been a positive, you know, step in the right direction.
I think it's really important because people get to have some ownership on their own health, work out what's important for them, why exercise and why the program, and understanding about your heart and your nutrition is so beneficial to prolonging your life expectancy and decreasing the risk of any further cardiac complications. It's just really nice to see these patients come here for their exercise programs and kind of take some ownership on why exercise is so important, and taking it further out into the community and continuing that exercise beyond just a 6-week program.
Here, it made you get into a routine of doing a daily walk. And that's where the partner comes in handy, because you do become a bit of a nagger. And also the diet, you know, you get education on what to eat, what not to eat, and why, and all the things to avoid. So that's where the partner can become a bit of a help at home.
Well, it got me back to, you know, stop feeling sorry for myself really, and just got back in with other people who are in much the same boat, and got me back to doing things at the gym, because I know that, you know, the surgery wasn't the end of it all. It was probably only the beginning. It's given me a new lease of life, I suppose you could say, and, you know, give you 10 to 20 more years, well, make the most of it.
The rehab program helped me a lot, because I realized it's, because I thought I was the one. I'm it, nobody else. Then I meet other people, and I saw how some of them really struggle, and that's actually motivated me. If they can do it, I can do it too. I think power of the group is unbelievable. Don't leave it on your own, because on your own you get depressed, you feel bad, you feel a little bit bad, and you give up. So I really recommend this one. I think it's very important for every individual, so get your life back. And that's actually what is with me. I try to get my life back the way I was before. It's not that it is easy, but life is not easy. Every one of us, it is your life, your choice.
I guess what I'm most proud of is seeing the progress that these patients make, and the belief that they have in themselves at the end of the program, when they came in frightened and some of them traumatised, and then they finish up. By the end, they're brand new people with a new lease on life.